continuing with my talk, as Dr. Kasturi has touched based upon the surgical periocular rejuvenation, I would be talking about the non-surgical periocular rejuvenation. And we have known the fact that, as we are progressing into this field, that instead of just lifting, just tightening, we need an overall rejuvenation where we need to plump it back to its original shape, size, and volume. And the best example is of a raisin and a grape. And there are other various examples, but this is the one which I like to give. So there are various tools, as we mentioned, the basic tool which in our hands is injectables. Surgery has been covered by Dr. Kasturi, and there are certain other, treatment modalities which I would just touch base upon. So I talk about the various P's when it comes to this treatment, which is the patient, product, protocols and preparation, procedure, physician-related, patients, and practice. So these are the P's I would be touching upon. When it comes to patients, who are your target patients? Practically all patients, unless the patient is having an unrealistic outcome or is not fit medically, and which are NMJ disorders in terms of, the Botox injections, some allergies previously, or aversion for being beautiful is another contraindication which I feel. So the product, as we all know, is botulinum toxin and hyaluronic acid fillers. I have no personal interest in these products, though I am a trainer with Allergan, and one of the other companies. But, these are the products which are available, time tested, FDA approved, and had a lot of literature in place to back you on, with all the data. But there are other soft procedures in terms of cosmeceuticals, chemical peels, dermabrasions, radiofrequency skin tightening, non-surgical facial tightening, combination therapy, stem cells, and so on and so forth. As the technology is advancing, we are having new and new machines for the non-invasive, minimally invasive treatments. I would be touching base upon the Botox and fillers mainly because that's the crux of the talk, as being the oculoplastic and ophthalmic surgeons. So we know that Botox is of type A, B, and, which has been FDA approved for, so type A has been FDA approved for cosmetic treatment, and type B is mainly for the functional. And we all know about how they're present and how they're used. A word upon various types of Botox in the industry. Basically, if you compare it with alcohol, everything has the basic ingredient is alcohol, but the way the alcohol is prepared, processed, and presented is what makes it rum versus an vodka or another drink. So these are called the basics of biologics. So this is based on how it is processed. So based on that, each product would differ from each other. Now, there are some consensus and recommendations, and these have been revised over the years. We have even Indian consensus on injectables, where how do we reconstitute Botox? How do we store? Where do we store the fillers? What is the best product to be used? And so on and so forth. So for Botox, we can reconstitute it with normal saline, non-preserved, and 2 to 8 degrees is where we store it. If it is not constituted, we can store it up to, if it is non-constituted, you can have it in your refrigerator for 6 to 12 months. But if it's reconstituted, within 6 to 8 weeks is what is recommended to be used. Hyaluronic acid, how does it work? It works on the extracellular matrix as a collagen. It works as an artificial collagen, binds water, plumps, rehydrates, and softens. We have fillers for all the levels of the face, starting from the bone remodeling to the fat, to the skin hydration. And even now there are fillers with the newer technology where you just put it at one spot and it spreads all over the face to give you the new collagen and vascularity on the face. So obviously we need the tools and the processes in place. I'm not going to go into detail of it. The procedure, I'm just going to touch upon the concepts because, to show each and every technique is, we have short of time on that. Understand the arrangement of the facial layers, where we want to inject, whether it is the superficial layer, intradermal, into the SMAS, into the soft, deep fat pads, or the bone. So the facial anatomy is very, very important. Face, there is no safe zone on the face because it's full of vascular vessels, superficial and deep. So it really depends on the anatomy understanding and your techniques, how you do it. Folds are the places where major arteries are present. So you have to be very, very careful, especially, we know the supraorbital, the dorsonasal, and your labials and facial artery. All the foramens are in line in the face, which bisects the midpupillary line. So when you're injecting, be careful about that. It is also important to understand the nerve blocks in this area. Skin is a natural barrier. So if skin is erupted, is not fine, there is a barrier dysfunction, please don't inject, because that can lead to secondary infections, hypersensitivities, and more complications. The muscular level, the muscles are very, very vascular and active and high on metabolic activity. So keep away from injecting on the muscles or intramuscular. But there is a concept of where we can do myomodulation, where we inject the filler on the muscle. So we're actually creating a barrier or a loading effect on the muscles and play with the agonist and antagonist to work on the facial features. A word on facial lymphatics. Overloading of lymphatics is a big no, because a facial lymphatic is a complex structure to understand. So not more than a certain amount of filler which has to be injected at a time. You can go into stages and then plan your treatment. Look out for systemic infections, pre-existing infections like dental, sinus, even the urinary tract infections, because they can lead to secondary infections and hypersensitivities in terms of fillers. As I said, please understand your anatomy well. Looking at the complications of fillers, they can be acute, delayed, and persistent. Nothing comes without a complication. So we have to be trained, we have to understand the anatomy, we have to be responsible for what we are doing. And the worst complication could be blindness, but the cases are very, very rare, and we have protocols in place to treat that. But yes, lumps, bumps, hematomas, hypersensitivities, infections, inflammations are part and parcel of especially the filler injections. There are papers on avoiding and treating blindness, and especially the central zone is a danger zone. So don't kind of experiment or be very, very, very sporty in doing all these things. So you need to understand your concepts very well while injecting, and because one blindness case, and it's really tough to handle. Now, while injecting the Botox on the forehead, there is some concept where we don't want to go too lower, because we don't want to inject into the brow muscles and cause the brow ptosis. We want to work on the forehead, the frontalis muscle alone. So stay away from that. If you're working on the glabella, work on your corrugator, superficial, and deep head. So based on where the muscle is placed, your injection depth has to be accordingly. Crow's feet, while injecting, people usually go overboard, either inject too much or in different points, go too deep. So be careful about the understanding of zygomaticus major, which is a smiling muscle. So if it gets paralyzed or it's injected, it's okay to do it in hemifacial spasms or blepharospasm, in some cases of blepharospasm. But in aesthetics, it would create a fake smile or an augmented periocular reaction, which is a big no. And we have seen a lot of fake smiles happening. So this is the cadaver dissection, where you can see the zygomaticus major actually running down from the corner, from the most prominent part of the zygomatis to the corner of the mouth. So that's the red spot where you're not going to inject. When coming to the teardrop deformity injections, obviously we understand the anatomy. Being oculoplastic surgeons, we don't want to go to medial and too deep, because our facial artery is running over there, and most of the blindness cases can happen in that area. So be very, very careful. And also there is an interanastomosis between the two angular arteries, which can lead to even bilateral blindness. And there have been 1 or 2 cases reported in the literature. Physician is important, because unless you are trained enough, the complications can happen. And we have to deal with them. So as I said, hematomas, allergies, hypersensitive reactions can happen. So training and knowledge is a must. Patience and practice is the key, because the most complications, skill can be made simple if we have a thorough knowledge. And of course, if you combine all these procedures, which I have not gone into too much detail, but yes, if you can combine, you can actually transform the faces, as Dr. Kasturi has shown, surgically, but also non-surgically. So we are venturing more and more into injectables, cosmeceuticals, non-surgical facial lifting. Are these a replacement for surgical procedures? No. So we have to, select our candidate properly, talk about the pros and cons, and as I mentioned, the trigger points, understand what's happening with the face, and then take a call on which treatment modality is best for that patient. So thank you very much for patient listening and hearing. And I hope this course was useful, and we can continue to do it live next year with a lot of, live demonstrations and, cross questioning. So thank you so much.